Hello everybody, welcome to the series, the Multiple Sclerosis Education Series. I'm Jennifer Nash. I'm going to be talking to you today about physical therapy for people with multiple sclerosis. We will, and then I will cut halfway through the night and let our new occupational therapist also speak with you today. So it will be twofold. You'll get double dose of therapy. Just wanted to start out because I'm not the only one here, letting you all know who is all here at the Cleveland Clinic in our neuro rehab department as far as physical therapists. So I have myself, then we have Christy, Malia, and Jason. We're all doctors of physical therapy with various specialties, including neurologic physical therapy and geriatric physical therapy. So why physical therapy? Why am I here talking to you about that? I took this from a great website that the Physical Therapy Association has put forth for the community, for all public, and it's called moveforwardpt.com. And it says that physical therapy for people with MS focuses on helping them return to the roles they perform at home, work, and in the community. What we really work on is trying to make sure that your body works the way you need it to get maybe walking to work, doing the job that you need to do, or whether it be at work or home, even something that you just like to do, but making sure that you do it. Maybe it's running and something prevents you from running that normal little run you run in the morning. We're going to help you work on getting that back. So what we do in physical therapy is first always complete an evaluation. We'd like to examine and understand where your weaknesses are and where your strengths are. With that, then we put together an exercise program based on those conditions and your goals, and always make sure that we give our patients an exercise program for home. That's really one key part about physical therapy, is increasing the amount of exercise that you have in your day. So we'll talk more about that. So when do you see a physical therapist? We've found through a lot of research that the early stages of MS is a great time to start, because that is when we can work on making sure that your walking ability, your balance, breathing, all of those things are able to stay normal. Or if it's just something we've realized and maybe we're not lost a lot of function, we're going to work on getting you back up to that normal place that you feel good about and working to keep you there and not have some limitations that might otherwise happen. When someone receives the diagnosis of MS, the best option is to begin with physical therapy right away to just improve any mild challenges and slow down the progression of the symptoms through strengthening. So we work a lot with exercise, all right? It's a lot about exercise. We work with aerobic training, so using a treadmill or maybe a bicycle, stair stepper, recumbent, walking, all different ways to get that cardiovascular training or aerobic training. Also working on strengthening, balance, and stretching. Now these are the type of exercises I would tell anyone that's important for someone, for our health, for our general well-being. We should all do cardiovascular exercise. Specifically, we should all do 150 minutes of it a week. So that works out to be about 30 minutes, 5 days a week, of getting your heart pumping, your heart rate up, and feeling that you can, having that difficulty talking when you're walking, let's say. That would be a good intensity for that exercise to be at. We'd also encourage not just people with MS, but everyone to work on strengthening all of our large muscle groups like our shoulders and our legs. We work on all of the muscles, our back muscles, hip muscles, twice a week during strengthening exercises. Balance training always is a good option for people, definitely in the older adults, but even people with some weaknesses, or possibly those with MS having a slight struggle with their balance and their sense of feeling. Stretching is good for everybody. Flexibility keeps us mobile, keeps us able to move how we naturally are made to move. So we always like to incorporate all of these things with our exercise programs: aerobic training, strengthening, balance, and stretching. So the goal of physical therapy, just to say it in one simple sentence, in the early stages is to help you perform all your normal activities that you want to do. We do this through, improving function. We often say we work to improve your function. Well, what does that mean? Well, it means if you have trouble getting in and out of bed, we want to help you not have trouble getting in and out of bed, okay? Or up and down from a chair. Maybe the chairs like these that don't have armrests aren't that easy to get up and down from anymore. Well, we want to make them easy, again, to get up and down from them. In and out of a car sometimes can be difficult for some people if they lose a little bit of strength or flexibility. We work on that: walking, stair climbing, running. So it really is just something that the physical therapist and you would work on, understanding where your difficulties are, and that's right where we'd go. We don't have a set place we have to start or finish. We just work on helping you do the activities that you normally want to do, that you might have a little difficulty with. So we teach the exercises. They'll strengthen your muscles, improve your balance. Posture is very important. Your balance and your posture really go hand in hand. So we're often working on teaching people how to correct their posture and increase their ability to stand upright and confident, as well as increasing your agility and coordination, so that possibly if something startles you, you catch your balance. A lot of times it's nice to have good coordination and agility, so if something you accidentally trip over a little spot in the carpet, bump in the carpet, you're going to recover from that and not have a fall. Those things are very important. We all work a lot with educating our patients and their caregivers, whether it's spouse, family, friends, all around on what's going on and how we can make sure to stay being as productive and normal lives as possible. And then provide resources. Occupational therapy and physical therapy work hand in hand. We're oftentimes talking about needs of patients or other resources that we might understand we have available and share that with our patients, such as social work or luckily we have Robert McVeigh here that is able to help with a lot of other things missing in this picture of how best to help persons with MS go on living and doing their daily activities like they want to be. So how do we do this? How do physical therapists get back, improve those minor challenges you're having and help you get back to your more normal living? We do it through motor learning a lot, which is just the process of acquiring a skill by which the learner, through practice, makes perfect and perfects the movement, I should say. Now, you've done this when you were little as a kid, when you learned to ride a bike, or when you learned to tie your shoes. You practiced that several times before you got it, right? That's the same thing. As we're adults, we are still able to learn. Learners can be of any age. It just might be with a different activity. But up here in the top corner, like this gentleman is using a device to help his foot drop, and he's he's relearned how to walk and using his skills on a very complex environment like that beachfront there. Or down below, she's got a device on her ankle that is helping her with her foot drop, and she's back to running again. So there's ways that we might either, one, be able to help the muscles work or compensate for the muscles working and able to do what they still like to do, okay? So motor learning is a great tool that we have, knowing that the body continues to learn through all our lifetime. And all we need to do is practice with the right exercises and the right equipment, and we can succeed at most things we are trying to strengthen or improve upon. Endurance, another thing we work on, just like I was talking, the cardiovascular training. Endurance is one of the most important aspects of fitness and healthy lifestyles. Keeping our heart strong and our muscles strong and being able to exchange oxygen and maintaining a good feeling about ourselves, not getting too tired, all very important with endurance. We need to be able to endure our whole day. And if we are strong in our cardiovascular system, our blood and our lungs and our heart are working well, we can usually tolerate a lot more during our days. Fatigue comes less, okay? When it's definitely something important that we work with people with MS, because fatigue, right, that is one hallmark sign that a lot of people, I should say, not all, but a lot of people deal with when they have MS. And so we are definitely very committed to helping to increase one's endurance gently through the tolerance around their individual situation, to allow them to endure and have a little bit more success doing the things they need to do throughout the day. We use strengthening to help protect our bone health, muscle mass, as well as it improves our body mechanics. So sometimes people's muscles may get weak on one side of a joint, causing the joint, maybe it's the knee, the hip, the ankle, not to move like it normally does, and that causes us a lot of pain and limitation. So if we just are able to diagnose and address that weak muscle, we're able to improve a person's walking, decrease their pain, increase their function. We also work on balance through specific exercises of balance. One important thing to think about is you can't improve your balance without practicing it. So holding on to something and doing some exercises may strengthen your muscles, but we really like to make our patients feel comfortable, keep them safe, allow them to practice their balance without some support, which would then not be balance anymore. But we like to make sure that they're able to stay in a safe environment to get back that balance that they might once had. And this will be very important in decreasing any risk of falling as well. And flexibility, I think I've spoken enough about the importance of the joint moving correctly. Every one of our joints, we want to make sure we stay flexible on both sides, all of our muscles. A lot of times what happens is we get really tight in the front and really stretched out in the back, and so we start to come forward. And we like to make sure we have good flexibility on both sides of our body. We can stay upright. That's where we're more balanced and able to be more productive and function more normally. Also, we work on coordination. So the ability that our different parts of our body can work well together. So this lady that's down on her hand and her knee, that takes a lot of balance and coordination to make sure she can maintain that posture. She's working pretty much every muscle in her body in that position. So every muscle in that body has to understand what the other muscles are doing and stay in a coordinated effort. At times, when we're trying to do something and your muscles might not do what you want it to do, that's one thing we tend to have a difficulty with, is that coordination of the effort. And with practice, through motor learning, coordination also can improve. There are times when it's best to recommend an assistive device because we're thinking about our patient's safety, wanting to maximize their function as well as their independence. So there are times when it's important and appropriate to think about using something outside of their body to help them do the things that they like to do. So assistive devices, not just the canes and the walkers, but I also wanted to bring up the orthoses for ankle weakness, like foot drop, oftentimes called AFOs, are some, I don't remember where it is. Oh. So right over here on the left, sometimes the ankle muscles are not able to become strong enough to endure the whole day, and it's beneficial to put a device like this in the shoe so that the toe is brought up and that tripping and stumbling don't occur when one is walking. Another different device that can help us work towards that same goal using electrical stimulation. There's actually competitors here. The top is called Bioness, and the bottom one is the WalkAid. Have anyone heard of either of those devices? So they use electrical stimulation, and rather than working on the nerve signal from the brain to the foot, we have a problem there, right? So we have some myelin missing, and we're not getting that conduction through with our MS. So what we do is we go right to the source, right to the muscle belly that lifts the foot up, and stimulate it with electricity. So that's why there's these cuffs right here on the legs. And what those cuffs are doing is actually stimulating the muscle right when your foot should come up when you're walking, so that you don't stub your toe, and it's able to allow that toe to be picked up, and when you place it down on the floor again, the electrical stimulation turns off, and it has sensors inside that knows when you're about to bring that foot forward for a step. So you don't have to do anything with it, but the machine knows and is able to help that muscle get the stimulation or the nerve signal it needs to work, just as it's meant to. So that's one thing that physical therapists are often looking to do if we are not able to improve their foot drop to a safe degree with just strengthening in our exercise programs. So this is something that oftentimes the first thing, if we are needing to think about assistive devices for people with MS, first thing is often one of these type devices. Because foot drop, I would say, from what we see, is one of the most common things for people who have MS, especially ones that have the difficulty with walking. But other indications that we might use assistive devices are, we've got unsteady walking or standing. Once you have fallen, you're definitely at a much higher risk to fall again. So it's definitely something that's on our mind, and we start to investigate and make sure we've got the best situation in line for you and how to prevent your falls. Limiting activity due to fear of falling. We really try to work, both occupational therapy and physical therapy, on making sure that our patients don't have that fear of falling or minimize that fear of falling, because what happens is when you limit your activities, you just really limit what you like to do. You're often cutting out going outside the house, socializing like you used to, and you really tend to not only get a bit depressed by that, but also weaker because you're not being as physically active. So that's one thing that we really like to make sure is not happening, is that limiting of activity. If we also notice that you're reduced tolerance to walking distances, like in the grocery stores or other areas, even maybe into the doctor's office from the car, you're worried about how far that walk may be, and so you take a wheelchair along or something like that, or we just need to make sure that you have something there to make, like a cane, so that you can get there safely. And then if there's an increased dependence on others, where an assistive device would give you that independence back, that's again a good indication that we should start discussing with you different devices that may be helpful. Just to look into like what a few of them are, there's this whole continuum along the chain of assistive devices we have here. First, obviously our whole goal is to have our patients walking safely with no device. And then oftentimes, possibly if it's foot drop or that ankle weakness like I was speaking of, we might go to one of those devices for your ankle. Beyond that, the cane usually comes next, or walking poles, as you see in the far left there. We really like those if they can offer good stability, because they often give us a better posture and make our arms move just like we are walking, and that's helpful for our balance. So canes then next, or walkers would then come after, and wheelchairs or power devices. All of those things, we as physical therapists are constantly assessing and making sure that we don't, that our patients have the right device if any is needed. So just a few key points about MS and physical therapy is that it is beneficial for people with MS. Starting early allows us to continue to help you to continue to perform those activities that you want to do, whether it's be walking into work or taking a run. It really is the whole gamut. Maybe you're just not able to do some household chores because you're not able to walk steadily. I mean, all of those things are definitely around that. Walking are something that a physical therapist is going to help you with. And the other thing to remember is you start out early, but you don't stay for very long. Oftentimes you leave and only then you come back to revisit with that person you already have a relationship with if you have any changes in your walking or your strength, flexibility, energy level, or balance. But it's nice when you start early and then you have a relationship and then you always have that person to call and you feel comfortable, something's going on, or doctor, I think I need to get back to my therapist because I'm starting to drag that foot again. I'm just noticing I'm tripping a little bit more than I was after I got done with physical therapy last time. So I was thinking that we'll save questions. Does that sound good? Okay, good. So I'm going to introduce our newest member to the LouRuvo Center for Brain Health Rehab Department, and that's Michelle Ashley, who is our occupational therapist. And then we'll both be here for questions afterward. Okay? Thank you.
So as Jen said, I am the occupational therapist here at the Cleveland Clinic. I'm not sure if anyone here has had occupational therapy before. So I'll give a brief overview and then talk about some of the treatment approaches that we can have to help people with multiple sclerosis. So for occupational therapy is skilled intervention that helps people become successful in their everyday life by engaging in meaningful activities. So we aim to help the person become as independent as possible in spite of the disease. So as it progresses, you might need assistance with certain things, but we want to be there to help you find adaptive techniques or different strategies so that you can continue to be as independent as possible. Some of the ways that we can do that is helping you to rehabilitate lost motor function in your arms, in your hands, in your fingers. Looking at that fine motor coordination, you might have some issues with that, so we can help in those ways. And then also cognitive function. So you might find that just memory, you're having some decline in your memory or other mental impairments, so we can help you with that and come up with different strategies and fun activities to hopefully preserve that as long as possible. We're also going to work with you with adaptive equipment just to help you more functional, whether it's in your home environment, if you're going to school, if you're still working, any of those things, we can help you with that. looking at environmental modifications and compensatory strategies. So if you find that maybe the way that the layout of your house is, it's just a little bit more difficult to complete certain tasks. So bringing in pictures, and then we can help you look at ways of modifying that so that it's easier for you to be mobile and be functional. And then a big component is, really working with the patient and their caregiver, and just making a very collaborative effort when we come up with treatment approaches or goals. It is definitely something that is with the whole family and the whole unit. So when we talk about occupations, that could probably mean a lot of things, but with occupational therapy, we break them down into different components. So you can see ADLs, that's what we consider your activities of daily living, and this is going to be your basic self-care skills. So we're going to look at, are you able to dress yourself, feed yourself, bathing? Are you having any impairments with that? Are you fine? Are you independent with those things? And then going down, there's the IADLs, which are your instrumental activities of daily living. And that's going to look at some of those higher level functional components. And so it's, have you done financial planning? So do you do the bill paying? Are you able to still cognitively be able to do that? Looking at driving, are you having any impairments with driving? And then let's say meal prep. Do you do a lot of the cooking? Are you finding that's more challenging, just doing those tasks? Rest and sleep is a big component. If you are in school, education, the work environment, play and leisure are big components, because you want to still be doing those activities that you enjoy doing, and having that leisure component to your life. And then social participation. So here I just have a few intervention ideas that with the MS population that can be seen to be beneficial to work on when you come to OT. And that, as a big one, is going to be energy conservation, and then leisure components. So with energy conservation, I found an article here, and it talked about how that most people with MS report that they do experience fatigue on a daily basis, and that it progresses in severity. And so this is something that, coming to occupational therapy, that we would work on some energy conservation techniques that will help you just improve your functioning and then your efficiency when you're completing those tasks. So for example, some of those basic self-care skills or those higher functioning skills, and just make it so that you're able to continue to do those things. And then by teaching these techniques, again, that's going to help decrease the fatigue that you're having, and then increase the quality of life and allowing you to continue to engage in activities that you find meaningful. So for some of the energy conservation techniques, we can look at work simplification. And with this, there might be things that you do every day and you don't really think about, but maybe you can tell that it's stressing your body a little bit different, or that you're becoming more fatigued. So simple things like if you are kind of the homemaker in your house and you do folding the laundry, even if it's when you're dressing yourself, washing the dishes, doing that from a seated position. So simple little techniques like that, so that you're not standing when you're completing them. Sitting is going to help you to be able to perform that activity, continue to be independent in that, but it's not going to put as much stress and fatigue you. Also looking at sliding objects instead of lifting or carrying them, making sure that you have good body mechanics, and then just knowing your body and knowing when to take breaks, knowing how to pace yourself. That might be something over time that you have to learn to build that in, so that you're not going to get too fatigued and you're able to complete these activities. And then again, kind of going back to the environmental modification, just looking at how your space is laid out. So for example, if you were going to prepare a meal, making sure ahead of time that you have everything that you want within easy reach, so you're not having to continue to get up, maybe move around and go to the pantry a lot, go to the refrigerator. You kind of have it all there, so that's something that you enjoy doing, you want to do, but it's easier on your body because you're not having to move around too much and expend that energy. So I have a couple examples on the next few slides of adaptive equipment that, if you come to occupational therapy, we have some things that you can try out yourself, different things if you find you're having an issue or an impairment with that, we can work with you to look at different pieces of equipment that will help you in your environment. So kind of in the top, you see someone that wants to prepare a meal and they have a stool there so they can do it seated. A cart that allows you to push items so you're not having to carry them, which is going to help you with conserving that energy. And then in the bottom, there's another one there, so that helps maybe if you don't have the grip strength, you have this device to help you put something into the microwave. But then also you might have some sensation loss in your fingers, maybe you don't feel heat as much as possible, so having this will also help you so that you don't burn your hands and you're safe when you're performing the activity. Here in the top, just maybe if you see that range of motion, you're having a harder time holding your arm up, performing things, whether it's brushing your hair, blow drying your hair, any of those things, adaptive equipment that can help you with that, also conserving your energy so you're still performing these activities, you're relying less on someone else, but adaptive equipment. With the teapot there, they have devices so that you can either, whether it's a tea kettle or maybe a gallon of milk or orange juice, you can set it in there, and then it helps you tip it over and pour it, so then if you lose some function in your arms or your wrist, or it's just too heavy for you to hold, you're still able to do that. And then other things, they have the pill boxes, which can help if maybe you're having some cognitive impairments and you're not remembering to take your medicine, some devices like that to help. And then, so here, there's another kitchen one, and then also with your bathroom, just making sure that, grab bars can be very helpful. I know with PT, you might be working on those sit to stands, getting up, and so this is just another aid to help you if you're having a hard time getting up. And then in the shower, this is a big one just because the shower, one, it's a wet environment, so there's a lot of room for slipping or falling, but it's also, if you like to take hot showers, that's very fatiguing on the body. You get very tired, it's warm, and so having a shower chair there, it just allows you to be safe in that environment, so that if you do feel dizzy, if you do feel fatigued, that you have something there that you can sit down. And then again, just another modification in the kitchen, a roll-out drawer, just making it easier for the person. So then for the second intervention that I spoke about was leisure participation. And with this one, there was an article here that I quoted, but it stated that engagement in leisure activities has been shown to enhance a person's overall quality of life. So whether it's a fear of falling or whether it's fatigue or any of those components, not to stop doing those activities that you enjoy doing, whether it's playing basketball or playing bridge with your friends, any of those things. So making sure that you're still engaging in social activities. And so looking at arts and crafts, social groups. We have in our gym area, we have like a Wii or the Connect, and so those are things that you're still doing tennis or doing boxing, but you're doing it from a seated position, and so you're not expending as much energy, but you're still going to work on your range of motion and doing some social, because you can interact with the whole family. So those are a lot of fun things, and social networking, and then again just helping to adapt a piece of equipment so that if there's something you want to do, whether it's golfing or crocheting, that finding a way to adapt that so you can still perform that. And here I just have another few examples. So with the fishing rod, if someone wanted to use that, or over off to the, I guess the left, all the way to the left, there's someone that wanted to crochet, but they had decreased grip strength, and just also to help with hand fatigue, they were able to modify that. So, coming to OT, just we would work with you on any of those things that you want to do, really looking at a way that you can continue to participate in those and find a way to adapt it. And then also down, apps are a big one. A lot of people like to use, if you have an iPad, a Kindle, or an iPhone, different apps for cognitive strategies and reminders, any of those types of things. And then another big component is, of course, that client-caregiver training and interaction. So making sure that my role as an OT is making sure that the whole family is educated on the symptoms, what to expect, and then the best ways to help that person be functional in their environment and in their space. Again, looking at those energy conservation techniques and helping the whole family realize, how to set up the home, how to help supervise the task, training both people on proper body mechanics, because we want the patient to be safe with what they're doing and to be able to be functional, but if the caregiver needs to step in and help, or the spouse or whatever, we want them to be safe as well too. And looking at the two working together to look at how to organize your day and plan your day. So maybe you find that you're more fatigued in the evening and you have more energy in the day in the early morning. And so any activity that it is that you want to complete, maybe there's one activity that's takes a little bit more energy than the other activity. So planning your day accordingly and doing those harder activities in the morning when you have all that energy and you're not having to worry about it later on. Teaching different coping strategies. Again, working with both parties to look at different opportunities within the community for engagement activities, and just again that family integration and education to help with MS support in the community. So do you guys have any questions for either of us?
I read that water aerobics was really beneficial for MS patients. I mean, is that something that you guys would do with them? Like, could you do like water training, so that they don't get hot? I know because it's very important for them to stay cool. Mm-hmm. So, I mean, I don't know if that would be beneficial for them.
We think it's beneficial.
Yeah.
Water is a great medium to exercise in. You're able to do it a lot with less pain.
Right.
You don't have the weight bearing on your joints and things that might be painful. It does keep your temperature down oftentimes if the pool's the right temperature. Right. We don't have access to a pool.
Oh, okay.
We would love to, have a pool right out there. We got a big dirt lot. We could, and then absolutely we would definitely incorporate it in our programs. So I think that's great if you have the ability, to be a part of some type of program or even just get in the water. And swimming is a great activity for anyone. Mm-hmm. But you're right that it does help people with MS for those reasons that you said. Good idea.
And also, when he was diagnosed, he was having a lot of speech problems. So, I mean, would going to a speech therapist help with that? I mean...
Yes, absolutely. Mm-hmm. Absolutely.
Oh, okay.
Yes, we both would love to have a speech therapist here as well. Uh-huh. We're just a growing program, and eventually one day there will be a third person there, because we think that the whole complement has a lot to offer people, and that speech therapists could definitely help when someone was working through, getting their speech back.
Right.
Absolutely.
Okay.
Yeah, no, great questions.
And typically, like when someone has a flare-up, like let's say they're like you said, the foot dropping thing.
Yeah.
How long do those usually last? I mean, does the physical activity make it be like lessen the length of time that the foot would be dropped, or I mean, would it maybe make it worse because they are exerting themselves more?
So physical activity, like physical therapy, or exercise in general?
Yeah, like physical therapy.
So no, I would definitely say that it wouldn't make it worse. Okay. That we definitely work to make it better. Okay. Yeah, and that's the great thing about the exacerbations, if there's any great thing, is that we usually get that stuff, that function back, right? And especially if you address it and work on, strategies and strengthening exercises that help that. And if not, we are working to make sure you're safe with some other means, But I would definitely say that it's not going to hurt to have physical therapy, and that you'd only move forward with being able to do the things you want to do safely again. So Grace, did I answer your question about exercise enough?
Yes.
You sure?
Yes.
Get out there. Anything from you, Lisa? Do you have anything?
Oh, I'm also a type 1 diabetic, and that was the problem I was having.
Yeah?
A lot of symptoms with the MS, I just thought it was my diabetes because my balance is off, I just figured my blood sugar was low. If I was tired, it was because of that. So I don't know how that would affect as far as my physical activity.
Well, it definitely does affect it. I mean, you do, we're all unique, right? We all have different things to go on, and that would be yours, that you definitely have to make sure your sugars, when you're exercising, are regulated and maintained, We wouldn't work you out like crazy and not expect that your sugar levels aren't going to, modify or drop. We're going to definitely take that into consideration with physical therapy, as well as you should with exercise. And that's something that a physical therapist can actually help you understand if it's not something that you or your doctor can get a good handle on. Because we work with that every day, working and helping people understand what to do around their exercise, around their diabetes, and managing it with exercise. Because it's still important for you. You still got a beating heart that we got to make sure stays strong to get blood to everything else, right? And those muscles, we got to make sure they stay strong as well to keep us walking. So it's all important. We just definitely would have to take a very close look and have a finer balance for you. But it's possible, absolutely. Anything that you were hoping to get from the presentation that we could improve upon next time? Add to it? Okay. We'll both be here if you have questions. Otherwise, did someone?
Yeah. I got a eStim unit.
Oh, okay.
Because I heard that it can help with numbness. If the numbness is in your feet, do you put it on your back or do you put it on your leg somewhere?
So, do you think it's like a TENS unit?
Yeah.
Okay. Usually that's at the back. You're stimulating the nerves there. And it is not something that I've had a lot of success with the numbness. That thing is such a bugger. I mean, have you had any change in your sensation with it?
Yeah, well, I haven't used it at home because I don't know where to put the electrodes, but
Oh, okay.
I broke my leg. I fell
Okay.
and broke my leg, and when I was coming back from that,
Yeah.
the therapist used it, and I did notice
Yeah.
a lot.
Well, one good point that you made me think of is that when we're using that eStim device on their muscle to make the foot come up from that foot drop, one thing that we notice is that people tend to just have a better sense of where their foot is because of that electrical stimulation zapping your leg all the time, and it's giving more input to that foot than it normally has because of the decrease in sensation. So that might even just be a mechanism as to a reason why you'd put it down lower and give it a try there, as not that it's something that causes your brain to recognize your leg, right? Because your brain isn't recognizing your leg as much as we want it to. And so I can think of a debate for either place. I haven't used a TENS unit in that way, but I do use electrical stimulation daily to stimulate the nerve, the muscle belly right there on the front of the leg. And people do have an increased sense of where their foot is just because there's something like bugging you down there. Yeah. Yes, sir.
Since we're in a desert environment, I
MS, are there certain undergarments, garments that you can wear to regulate your body temperature that you can wear?
Yeah, we both were suggesting like the exercise wear, the dry fit that wicks moisture away from your body.
I know you used to have something called a cool shirt.
Oh, yeah, the
They
cool
have,
vest.
Yeah, cooling vests.
Yes.
That you can get, and a lot of times, I believe it's the MS Foundation actually has them for free for a lot of people. And they have different sizes, different varieties, so if it's too heavy with the ice packs, they have some different options.
Yeah, it's a vest that you actually wear over your shirt that has little pockets for ice packs. And that is how that helps regulate your temperature in the warm environment we have here. Yeah.
I was just
There's-
thinking of it like,
Have you really? That's great. You know, some other people, my other patients really like even just putting those bandanas you can get and wetting those and putting them around. Yeah, exactly. And it's kind of like a, a bandana look. I get them at like REI or something like that.
Yeah, they also have, and I've seen them at Walmart, they're called frog togs. So they're like a towel that like you just kind of like,
Oh, right.
wet,
Yeah,
and
yeah.
you can kind of put it on your lap or your back.
Yeah,
It's very
frog
light.
tongues.
Yeah, which is very much lighter than the vest. But
Which is one complaint about the vest, right? But if
Going
the
into
cooling,
110 degrees.
I was just gonna say that. That's what I was just gonna say. Absolutely, it definitely helps in our 110, 120 degree weather out here. Absolutely. So that was the MS Foundation that you can go and look into possibly getting a free one.
I also have forms for that.
Oh, look at Heather has forms. See Heather.
They also have hats. And if she doesn't, I have that information.
Okay.
Oh, okay.
So yes, Felicia's also letting me know they have hats for that as well.
And also some nice
Yeah. So that head, you want to make sure to protect that. Yep, absolutely. All right. Nothing else? Come on, ask Michelle a question.
is it true that doing like Sudoku and stuff like that really does help keep your brain, or is that just?
I mean, I don't know if I would say it would solve the issue, but I think anything to keep your brain active, anything that's going to challenge it. So whether it's Sudoku, or I know a lot of people in the older population that still play bridge. So any of those things where you're keeping your mind engaged, I think it's also kind of better to have that in a social environment as well, because then you're making different connections. But I think it would definitely help keep your brain active. So.
Use it or lose it for a lot of
Yeah.
our tech, a lot of what we do, physical activity, mental activity. If you're not stimulating your body, if you're not stimulating your brain, your mind, they become weaker, they become less sharp, less responsive when you need them. So it's good to have a regular routine of keeping both your mind and your body fit.
I think anything you do that will challenge it is going to be beneficial.
Yeah.
So.
Absolutely.
Tell my husband to leave me alone.
That's right. She has a 10-minute hall pass. All right, so everyone here doing 150 minutes a week of exercise?
Well, I work at a bar. I'm a bar band, so I move carrying
You're
stuff
moving.
around, so
Oh, you're
that's,
carrying heavy things, aren't you?
Yeah, so that's my exercise throughout the week.
Yep. Well, and it's there's something to be said about staying fit and being able to, if you become weak, especially say on one side, the lighter you are, the easier it will be to move and get back to where you are. You know what I mean? So you have to stay. You have to keep yourself in shape so that you can endure and move through it. We thank you for coming and having us. And thank you, Heather.
Thanks, Jen.
Yeah.